The one question which is most bewildering is that how come Kerala, which has one of the best indices in public health safety measures, has a terrible record when it comes to strays causing death? Sample the statistics and you shall sit up that this happens in Kerala. In a span of just 7 years, the state has witnessed a doubling of dog bite cases. In 2024, Kerala reported 3,16,000 dog bite cases, a dramatic rise from the 1,35,000 incidents in 2017. In 2024, the number of rabies deaths stood at 22, and in 25, it has been estimated at 13. In the recent case, 2 children in Kerala died of rabies within a week. 6-year-old Sia Faris from Tirthurangadi and 7-year-old Nia Faisal from Patnapuram. Sia died on 29th of April at Kozhikode Government Medical College Hospital a month after being bitten by a stray dog. Samlanul Faris, that is her father, claimed that his daughter was first taken to the Taluk Hospital on 29th of March, but later referred to Kozhikode due to unavailability of a doctor. Sia's family has alleged that no one came to their rescue and they were left themselves to clean the wound of the child before she was given the rabies vaccine at the medical college. Nia Faisal, who's from Kollam district, died on 5th of May at SAT Hospital in Thiruvananthapuram. She was attacked by a stray dog on 8th of April, and although she received multiple doses of the anti-rabies vaccine and was also administered immunoglobulin, Nia developed a fever and was diagnosed with rabies. According to doctors, Nia's wound had a ruptured vein, 2 deaths, and both after being administered rabies vaccine. The stray dog menace is a larger problem, of course, which requires intervention from the government and other agencies, and which frankly has little or no impact so far. But then, even if that may be true and that door may be shut, what about deaths despite medical intervention? Let's debate. We have a guest who's spoken about this many times, and therefore it's very important that we listen to what he says. Dr. Rajiv Jayadevan, author and convener, Research Cell, Kerala IMA. Thank you so much, Rajiv, for joining us on this broadcast. Rajiv, a lot of stories I have done on the rabies and rather stray dog menace in Kerala. Last year, it was such an epidemic. I mean, it spread like bushfire. There were killer stray dogs. I spoke to several people, animal activists. I spoke to doctors. But everyone said something will be done. They should be neutered. They should be taken away to a home, etc. But nothing happened. Now, the question now is different in the case of these 2 young children, girls as it were, that you get rabies vaccine and then you lose your life. How does that happen, Rajiv?
Good question, Sudha, and it's a tragic situation when you lose anyone, family member, particularly children, to this dreadful disease, which can be prevented. It can be prevented on many fronts, and as you alluded to, most of the rabies deaths in India come from dog bites and a few from cat scratches. Now, dog bites could be either from stray dogs, as you mentioned, but also from pet dogs. Just to take you through the numbers, in Kerala, which has around 2.5% of India's population, the number of people bitten by dogs is over 3 lakhs in a year. And a third of them at least are stray dogs. Now, not all stray dog bites are rabid dogs, but we do not know if the dog that comes to bite you is rabid or not. So that is the problem. So when there's a very large denominator of dog bites, yes, a few of them will go on to develop rabies in spite of vaccination. That's a harsh reality. Worldwide, if you look at the statistics of people who develop rabies, most of them developed it because of either lack of access to vaccines or failure to recognize the need to vaccinate. Now, there are very rare instances of people who develop rabies despite getting medical care. And there are published data on these very rare cases. It is so rare that it is said that if the vaccine is given according to protocol and the person is given first aid on the spot with washing with soap and water for 15 minutes thoroughly
Yeah.
of all the wounds, the vaccine and the treatment is 100% effective. So those rare cases of apparent vaccine failures are attributed to the following four factors. Number one, rabies is caused by a virus that travels through the nerves and tracks its way backward into the brain. And once it reaches the brain, it is fatal. No treatment can reverse it.
Okay.
Until it reaches the brain, we have a window of opportunity. Most of it is at the wound itself. Remember, there is the dog saliva on the wound, and there are millions of viral particles in that saliva waiting to get a ride on to the nerves. If you can finish the job right there, that is by washing on the spot, not in the hospital, but as soon as someone gets bitten, the first thing to do is to wash the wound with soap and water for 15 minutes. Why? You wash away the saliva, the viruses go away, and there are only very few viruses left on the wound for the
Hospital, is
vaccines.
it? You know, Rajiv, you're not blaming the hospital for what happened to these two children because they were taken to very good hospitals. Why did
Yes.
they, why did we lose them, or why did they go into critical condition despite having the vaccine? What is
Yes.
wrong with that? Is it because it traveled to the brain?
Yes, of course. These children were bitten on their face, their hands, fingertips, and also their parts of their head because children are small and they tend to fall down and the dogs viciously attack them and
All
they
right.
get deep.
Okay.
So the virus gets a easy ride into the brain even before the vaccine gets a chance to act, and that's a fact.
All right.
Whereas if you are an adult, you are typically bitten. I've been bitten by stray dogs in Kerala, and I had to take the vaccine.
Okay.
But I was bitten by a dog that just crept up from the back, bit me, and ran away for no reason.
Yeah. So basically, there is a lack of awareness, is what you're saying, Rajiv Jaydevan. I've completely run out of time. I just wanted you to
Right.
quickly tell us, you
Yes.
know, that this is the reason. There has to be more awareness. Thank you so
More
much,
awareness.
Dr. Rajiv
First aid.
Jaydevan.
First aid matters the most.
Yeah, the most. Thank you. That's very important what Rajiv Jaydevan just said. First aid, first aid, first aid.